of, yes or no? The anatomy of elimination. We yesterday considered the importance of elimination, and we considered the various organs in regard to it. The one organ which is most important in this respect is the skin. We have to realize that the skin is a tissue of the body. And more than that, it is an organ. It is an organ. It's a huge organ, probably the largest in the body apart from the liver. It is an organ that is spread out over about 2 to 3 square yards. I skinned you alive, you would have a skin about this considerable depth when you look at it in a microscope, with a piece entity. It's not just a covering, it's a real entity. And it has deliberate functions and structures related to those functions, which is what we call morphology, and they are very important to man. This skin, this organ, known as the epidermis, has certain functions in the body, and you should remember what they are. First and foremost, it is a protective mechanism which protects the body against trauma, blows, violence, tears, ripping, all sorts of actions. Of course, you understand that. And also, just as important, it is protection against invasion by bacteria. Last night we saw how a cleft in the skin led to an inflammatory reaction in the body. And if you know anything about medicine, you'll know that that inflammatory reaction was so comprehensive and so all perfect for very good reasons, that bacteria can multiply at an incredible speed. They can double their numbers every few seconds. And if you don't know what that means, then you just take the number 2 and double it a few times, and you'll see what we mean by that. And one germ in a matter of 36 hours can become several million, once it is provided with an adequate food and an adequate environment. The adequate food is provided by the blood that it might enter, and the environment of 98.4 degrees Fahrenheit is ideal for its multiplication. And the body knows this, is aware of it, and reacts to it in inflammation. The skin itself has a definite depth, and therefore it has an anatomy. And so I'm not going to go into it in great detail. I am here to provide you with elementary knowledge which can assist you in your esoteric healing methods. Thank you very much. How kind of you. The outer surface of the skin is called the epidermis. The epidermis. And it is made up of cells, of course, like all parts of the body. And in the deep part of the epidermis, the cells are relatively round with a nucleus and can be seen like that. There they are. But they grow outwards in that direction and gradually become flattened and die. They lose their nucleuses and eventually die. So they are growing outwards, and they are becoming, as it were, sloughed off from the surface of the body. Every time your clothes rub the surface of the body, you lose showers and showers of your surface epithelia. In fact, when you share a room with somebody, you are breathing. When you share a room with somebody, you are breathing in their cells. You are taking in all sorts of their material. May I ask what you did with that? Oh, I see. So this is the epithelium. Now, what is its importance? Its importance is, of course, that it is a protective coat against penetration. Water cannot penetrate it, nor can oxygen penetrate it from without. In fact, though, there is a lesson to be learnt here, and that is that water in contact with the skin affects it profoundly. Water affects the skin profoundly, and very quickly these outer cells become sodden. They become sodden with water, and they peel off, and so on. Wetness between the toes means skin that is spongy. Wetness between the toes means skin that can provide food for certain organisms. The organism mainly between the toes being, of course, a fungus known as tinea pedis, and it is a fungus that causes athlete's foot. So when skin is wet for a long time, it can become dangerous. It can be penetrated by organisms like fungus and bacteria. So although we say that the skin is impervious to water, we really mean that it is impervious under normal conditions. Then the deeper structures in the skin give the clue to their functions, the function of the skin. We have, of course, hairs that lie embedded in the skin, and each hair root is supplied with a blood vessel. In fact, it has a capillary fed around the root of the hair like that, and so the hair is able to grow outwards. It is fed with oxygen and food and so on. Around the edges of the hair, we get a strange organ which contains an oily material, and these glands contain a material known as sebum. Sebum, an oil, a sort of oily material that one would find on the feathers of a duck or a goose or something like that. Sebaceous glands, we call them. Sebaceous glands. These glands are very often easily contaminated. They're easily contaminated by dirt and bacteria getting down along the edges of the hairs and feeding on the sebaceous oils there, the materials there which are ideal for them. No great problem in adults, but in children, or I should say in adolescents, there is a swelling of these glands. They become engorged as a result of hormones which are at play in the child, or rather in the adolescent, and in that condition these glands are easily infected and can produce the condition known as acne, where the infection of the gland causes a swelling on the surface and a pimple which is often interfered with, and the child becomes a mass of spots to his chagrin and to the extent that his personality may be affected. There are many ways of treating acne, of course, and it is not nearly the problem that it was when it was in my day. The first thing that you insist on with a child who has acne, of course, is that the child has his own towel. Most important, especially when the child has siblings. It's a simple thing. The child must have his own towel. He must be encouraged to use a face towel separate from his body. He must be encouraged to dab the face rather than to pick at it and smear it all over with a towel and carry infection from one site to the other. There are other ways of treating acne, and of course the ultimate deterrent, I suppose, is the antibiotic. But in England, I treated very successfully acne by the use of magnetic fields applied to the surface of the skin. These were used by me in conjunction with a pad of cotton wool which is laid over the infected area, and the cotton wool was soaked in a material, I don't know if it's available in the United States, it's called in England Busol, and it's going out of practice, going out of use. Busol, which derives from the Edinburgh University solution of lime. Busol is used in the war, contains a lot of calcium, was used in the war for very, very badly wounded soldiers, a method of clearing the dead material out of the wound very quickly, eating the dead material out of the wound before it healed up. So you can get it probably made. I don't know what it is over here, what it's called, but that's not imperative, but some useful material that can be laid there, and the magnet laid on top. I'll be talking about magnetism later on with regard to north and south poles and so on. So these are the sebaceous glands around the hairs. The next structure in the skin that we must take note of is the sweat pore. The sweat pore. And the sweat pores, of course, are found distributed on the epidermis. These are the openings, and I'll draw one in there. And then there is the sweat duct. It goes right down through the epidermis into the dermis itself, and is a coiled structure, a blind tube, and that is the sweat gland. Here is the gland, there is the duct, and there is the pore, or the duct and the gland itself. Now, sweat is a strange material. It is an excretory material, but it's a very useful excretory material. The water in the sweat, and that is the main composition of sweat, the water in the sweat comes to lie on the surface of the skin, as you well know. And in evaporating, there is loss of heat. The only way in which the water can evaporate, or the sweat can evaporate, is by absorbing heat from the atmosphere and from the skin. And therefore, it is the only way in which the body can cool down once the outside temperature goes up to more than 98.4 degrees, which is blood temperature. The moment the outside temperature goes up over 98.4 degrees, sweating is the only way a person can cool down, apart from the artificial methods like drinking ice water and so on, but on his own accord. And sweating, therefore, is an important mechanism, and it is one which involves a whole ramification of devices calculated to cool the body. In the skin there lies, as you probably have guessed, capillaries, tiny little thread-like vessels which hardly ever carry any blood in them. But when we are hot, when we are very hot, these capillaries open up and carry an enormous amount of blood in them. So the skin turns red, because the capillaries are having blood shunted into them. And so a person like you or me, when we are hot from exercise or on a hot day, shunt half our blood, off the body's blood, into the skin for cooling. The skin acts as a radiator. It loses heat by radiation, by convection, and by conduction. Conduction to cool air about it, and by radiation, and so on. It acts as a cooling unit. Now, we cool ourselves down by means of the skin. However, some animals don't sweat through the skin. A dog doesn't sweat through the skin. A dog cools itself down on a hot day by allowing blood in vast quantities to flow through his tongue, and he lolls his tongue out. And the tongue is wet, and it evaporates. The water on the saliva and materials evaporate, and in this way the dog is able to cool down. He assists this process by panting. So we use the skin, and of course we today very rarely go through a summer without having artificial devices to help us. The sweat gland is therefore important. It excretes water, which has been in the cells. Don't forget that it's been in the cells, and it's a real excretory product. It excretes salt, and in fact you cannot live very long in a hot climate, in a hot atmosphere, sweating, unless you replace the salt that is lost. That's the most important thing in areas and countries like this. If you have children who are going out on some venture or the other in hot weather, always be sure that they not only have water with them, but salt with them as well. Equally important. Cannot sweat ad infinitum without replacing both water and salt. you don't replace the salt, you can suffer very quickly from heat stroke, dehydration, and all sorts of conditions which can lead to permanent damage. So here we have then the structure of the sweat gland. There are many interesting factors about sweat glands. I have noticed, for instance, that many young people, in England especially, sweat mainly through their feet. And this can be a very unhappy state of affairs. They sweat almost as if nowhere else but under their, rather through their feet, and sometimes through their hands. And I have never read any reason for this, why it is. I do know that such children very frequently are emotional people, and there is a definite close relationship between the integration of an astral body with the degree of sweating and how the person sweats. Everybody does sweat. Everybody has an astral body. But the way in which a person sweats is often indicative of the condition of his astral body. Now, if sweat glands are used in a hot climate whilst you're young, all over the body, they will tend to be maintained all your life. If they are not used when you're young, they very frequently won't open up later on in your life. So the best condition that anyone could have from the point of view of sweating is to grow up in a hot climate, and you can change and do what you like later. But according to the degree of temperature of the environment will decide how many sweat glands you will have functioning for the rest of your life. In England, children have little chance of sweating. They tend to live in a cold climate, but they have the unhealthy attitude of keeping their feet well covered with socks and stockings and shoes, and over the shoes some Wellingtons and so on, and they are inclined to keep that part of their body hot and fetid for days on end. With the result, in the end, this is the only part of the body that actually can sweat. When hot weather comes along, the other part of the body just can't sweat anymore. They have grown into adulthood. The sweat glands have never functioned and never will. Not as many as they should, anyway. And so this can be quite a problem. The cure for sweating or not being able to sweat or sweating in unhappy places and so on tends to be a process whereby you can get the individual, this is non-medical, this is my own observation, esoteric if you like, where you can get the individual to be in a hot environment for about 3, 4, 5 weeks. And then pores that are closed will tend to come into function, no matter how old they are. They will tend to come into function, and thereafter they should be kept functioning. Thereafter you can recommend them to have a Turkish bath. What do you call them over here? I'm frightened to say anything over here because Turkish baths have become massage parlors and all sorts of things like that, and I don't want to be quoted as recommending massage parlors. But they can be kept open thereafter pretty frequently. Sometimes you get people who have difficulty in sweating, and the problem is that they present with headaches on hot days and general out of condition whenever they exercise and so on. So there's the problem of sweating. There is something else that we should remember whilst we're talking about the atmosphere given off by a body, and that is the atmosphere of fear. Fear. We're talking about the astral body, and fear is an aspect of it. The astral body transmits its energies into the physical body very, most frequently, directly through the white cells of the blood. We are taught esoterically that the astral body transmits energies to the etheric chakras. This is true. Directly to the white cells of the blood. And fear, acting on the white cells of the blood, or high, intense emotion, is radiated outwards. Animals can sense fear in an individual. An animal will always attack an individual who is fearsome rather than an individual who is not afraid, as we know for a fact. It's not just an old wives' tale. And this has been a mechanism whereby animals have in the past dominated even mankind, dominated and have learnt to sense when a prey was ready for kill. The moment that the animal was absolutely scared stiff, it could be calculated to make mistakes, and then the predator would move in on it. And this is a fact today, and many clairvoyant people can tell. Even you and I can tell when we go into a room or when we're confronted with somebody, whether they're in a state of fear. They give, we call them. In fact, much of it is radiation from the white cells of the blood. It's something worth thinking about. We're talking about the skin. We've talked about the sebaceous glands. We've talked about heat regulation, talked about sweat glands. I think that's just about all you need to know about the skin. But as we were talking about inflammation last night, let's deal with what happens after the inflammatory reaction in a cut has abated. We were talking about a break in the skin last night, a cut, talked about the way in which the wounded cells excreted a material like histamine, which caused blood vessels to become engorged in the area, and the whole area becomes red and inflamed. We learnt how the blood vessels begin to lose their plasma and their serum, and this increased the amount of liquid in the area and the swelling, so that the area became walled off. We learnt how white cells left in vast quantities the blood vessels and attacked the debris, the bacteria in this area, and changed into pus cells laden with material, dead material. We learnt how the lymphocytes, which had been alerted by the same material that is released from wounded tissue, also invaded the area out of the lymphatics in the area, blind tubes that take body fluids back to the heart. The lymphocytes emerged and turned into phagocytic individuals that were able to devour material, and so the whole area became a virtual ferment of activity. The ultimate, rather the end process of all this is to produce in the skin a cavity in the skin which is nice and clean. The moment that this occurs, all the debris has been lost, then the cells which are left, the healthy cells that have not been removed by phagocytosis of the white cells or polymorphs, these begin to grow inwards into the cavity. And near the surface, this is what you call proud flesh in a wound. If the wound is very large, I had a wound on my back in the war which was about that size. And when this had been cleaned out with Usol, and the flesh began to grow inwards into the gap, it had to be, as it were, burnt down each day with silver nitrate pencil, because the proud flesh not only fills the wound, the cells fill the wound, but unless they are controlled, they will burst outwards and grow above the skin, and you'll get an unhealthy raised area there that could break down any time. And so this must be carefully controlled. In a cut it doesn't matter, a tiny little cut, but in a large wound it is a problem. Now when this area fills in, you'll get special cells growing from the epidermis across this gap from the epidermis with strong fibers, and you'll get a scar or cicatrix form. And that scar is very, very strong. It's even stronger than the skin itself, and it will protect. All this, of course, usually goes on underneath a scab. A scab is made up of dried blood and serum that has oozed out of the tissues and hardened. When this process is complete and the delicate tissues are established, the scab falls off. It dries and falls off. So this is more or less the conclusion of the sort of wound you might have to face. Wounds on the body vary in their ability to heal according to the health of the individual and the age of the individual. The physiological age of a person is not the number of years he has lived, but the quickness with which his wounds heal. I'll say it again. The physiological age of an individual, an indication that he may live longer or a shorter period under normal conditions, is the speed with which his wounds heal. Some individuals, a cut like I have described, may take 2 days. Produce a cicatrix, it may take 6 days, it may take 10 days. Depends on the degree of physiological health of the individual. All right, that concludes the discourse on, I don't in fact know how I got onto that because, oh yes, we were talking about the skin, weren't we? And the skin as an organ of excretion, There are parts of the body which are difficult to heal, especially a part of the body which lies at the base of the spine, where you have the buttocks, and just in between the buttocks, round about here, is a very difficult area of the body to heal because of the poor blood supply. And any wounds there quite often are hard to heal. And the worst place for healing such wounds is generally a hospital, where there is constant infection floating around in the atmosphere. And if ever you get wound healing to do by esoteric methods, it is likely to be a cleft in the skin where there's a poor blood supply, especially at the base of the spine. And again, do-sol dressings, soaked dressings, regularly replaced every 4 or 5 hours, with magnetic fields lying on top of them, magnets lying on top of them, is a very good method for wound healing. Very, very good indeed. Other places where poor blood supply makes wound healing difficult is the nape of the neck, just there. That's the jaw of this individual. And this part of the neck has a very poor blood supply, that part there. It's the place where children very frequently get boils. The boils out because the skin, rather the flesh, has a poor blood supply and cannot defend itself against infection. It's a place where children have their heads shaved by barbers with dirty instruments and can become easily infected. It's a place where hairs are clipped so short that the sebaceous glands around the roots of the hairs can become infected. And it's a place where the clothes, the neck rubs, the cloth of the shirt collar rubs against the neck, and if the person has a poor skin anyway, then he is susceptible to boils which can disfigure and prove bad points for personality development later on. So we have considered then the skin. Now I want to go to the next organ of elimination of importance, which is the kidney. I'm going to deal with the lungs in respiration later and not today. Remember, of course, that the lungs are concerned with the excretion of carbon dioxide from the body. But the kidneys are probably the most important organs from the point of view of excretion, and if they become defective, they lead not only to invalidism, but can lead to a very rapid degenerating condition and death if they are not repaired. The kidneys are filters. They are filters of the blood. They not only filter the blood, but they reabsorb from what they have filtered back into the blood important materials. First of all, they will selectively filter out of the blood certain materials and then reabsorb some materials that have been filtered. Generally speaking, sugar is filtered out of the blood by the kidneys, and the blood sugar level is fairly static for most people. The kidneys will filter the sugar out and then reabsorb it back into the blood to a certain extent, generally all of it. If the person is healthy, generally it can't cope with all the sugar that's coming through in a diabetic, and some escapes down the urine, the tubes into the bladder, and this occurs, of course, in diabetes as well. Now, we have, therefore, a delicate organism, but generally speaking, a third or to nearly a half of a kidney is sufficient to keep a person alive. By that I mean that if the person has medical advice, doesn't eat too much meat, because meat, as I have emphasized, protein rather, as I have emphasized again and again, requires half of its content to be excreted from the body in the urine as nitrogenous waste, urea. And if a person has weak kidneys, he must be careful about the amount of protein he eats, because the kidneys have to eliminate the protein and do work. That's the important thing to remember. That the kidney has to do work in excretion. The heart has to do work, pumping. And if an organ is ill or diseased, the best thing you can do for it is to rest it. That's the first thing that you do when any patient comes to you. Make absolutely sure that they rest while nature does her work. If you do nothing else, even whilst you're fiddling around for a couple of days trying to decide what's wrong with them and what you're going to prescribe, at least be sure that they will rest, relax and rest. So, we're considering now the kidneys. I could give you the fright of your lives by doing anatomical drawings with regard to the structure of the kidneys, and you would get a fright, and you'd never forgive me for putting you off medicine for the rest of your days if I spent the rest of the night describing the structure of the kidneys. Very, very briefly, however, I will say what happens. Kidneys receive a very, very great blood supply straight from the aorta. We all know what the aorta is. Did that on the first night. The great bridge of life comes out of the heart, curves down behind the heart and goes through the diaphragm into the abdomen. And one of the first major branches it gives off is the renal artery. Edson, we always talk of the kidneys as renal artery, kidney artery, renal. And the oxygenated blood goes into the kidneys. It has to do two things. First of all, it has to supply blood to the kidney tissue so that the kidney cells can do their work. And it has to supply blood also for filtration. So we tend to get rather a complex supply of blood to the kidneys. Very, very briefly, a kidney is made up of millions of units which are called glomeruli. A glomerulus, see how the long words like cyanocobalamin are threatening all the time, and I'm trying to save you from them. Here is one I can't miss. The kidney is made up of a lot of glomerulus, or glomeruli is the plural. What are these? These are little filtration units, millions of them. And if that's the surface of the kidney, we could put in these little filtration units. There's one. There's another. There are millions of them. So I'm going to draw one enlarged now. I'm going to draw it here. And red blood comes in to each one of these tiny little filters which lie in the cortex of the kidney. Blood comes into each one of them, and it breaks up into a capillary network like that. And this capillary network lies in a cup, and that's what matters there, a sort of a cup, which is the top end of a tube, and then it goes out again. And inside this tuft of little blood vessels, the blood is under great pressure there, and the filtrate is forced out through this cup, or Bowman's capsule. It's called Bowman's capsule. And out of this capsule there drips, under pressure, the filtrate. All the materials which are to be filtered out of the blood, including the toxins which are dangerous, the useless material, and the useful material. The cup, or Bowman's capsule, tends not to filter proteins out of the blood. The red cells don't fall through, the albumin and globulin doesn't fall through, unless the kidneys are diseased. If they are attacked by some infection, they have an acute attack, which is a sudden, rapid attack, acute nephritis, or chronic conditions. And then proteins come through this capsule, and they show in the urine, can be measured in the urine. One of the tests that doctors use to assess kidney disorders and many other disorders in the body, like diabetes, is to examine the urine of the patient. And if the urine has got sugar in it, in the old days, do you know how they used to tell whether a patient had sugar in his urine? Well, of course, the doctors used to taste the urine. That is perfectly true. And many very healthy people who are interested in preserving their health taste their urine, and some will even, if they love their work sufficiently, will taste the urine of patients. And this brings out what I have suggested many, many times before, that the true healer, far from being averted by the condition of his patient, the ugliness of the disease, the grossness, the stench of decaying flesh or foul breath, and so on, the true healer learns to love his patient, and love the patient so much that he loves the disease as well, is never repulsed by any condition of the patient. I had a youngster at my school once who had pretensions towards being a doctor, and one day in my clinic I had coming in a certain lady whose breast was slowly breaking up with carcinoma, disintegrating. She was being treated with magnetism to hold the carcinoma in situ in its position, and this young man was invited to the clinic that day. I used to teach during the day and do my clinic at night. By that I mean from 4 o'clock in the afternoon. And I invited him in to assist me dress this wound of the breast that was breaking up. And it is always a ghastly sight to see. I'm sure some of you have seen such a thing. And it had an effect on him, and the effect was that he decided that medicine was not for him, and I knew it wasn't for him. To be confronted by such conditions, you may say, is a terrible thing, but that's the very first thing they do to medical students, is to confront them with the worst possible atrocious situations that they could possibly come across. And even if they drop on the floor in a faint, they are continually subjected to that until they begin to realize that the fun and games is over, that they are entering an adult profession, and that this is the day that it all begins. Love the patient and love his disease with it. Love where you are, of who you are with, and love what you are doing is the great maxim of the second ray. So we have then filtration units, millions of them. And down this long tube that coils on its way out of the kidney, there are cells lining it, all the way down the tube on either side, and of course circling it. And these cells reabsorb some of the filtrate, not all of it. The body needs salt, it will absorb salt from the urine, from the filtrate. If the body needs a variety of materials, it will reabsorb them. It will reabsorb all the sugar in the filtrate, from the filtrate, and so on. It will reabsorb vast amounts of water. The kidney may have 400 pints of water. I think it's 200 liters. 400 pints of water pass through it, through the kidneys each day, and it will reabsorb 394 of these pints of water through these tubules, which means that the kidney has an enormous range of activity, and it's hard work. About a third of the blood passes through the kidney continuously. All blood then goes to the brain. All the time, water is filtering through. 400 pints of water a day is a lot of water. It goes through two tiny little organs. And as fast as it is filtered, it is reabsorbed, almost all of it. On hot days, practically all of it. On cold days, when we're not losing water by sweating, then the kidney doesn't absorb so much water. What decides how much it will and how much it won't is a region of the midbrain, a region of the midbrain where cells act on the posterior pituitary gland, an endocrine gland in the midbrain that we'll be discussing next week. And this gland secretes the antidiuretic hormone, which acts on the kidneys and tells the kidneys how much water to reabsorb and how much not to, and so on. The main function of the kidneys is to create a concentrated urine. If the urine is not concentrated, the kidneys are not working. If a person begins to produce a urine that has the same specific gravity as water, is just like water, then the kidneys are not working properly. So we can measure the efficiency of the kidneys in many ways. The specific gravity of the urine will indicate the degree to which the kidney can concentrate urine, how much materials it is putting into the urine. Another function of the kidney is to maintain the electrical balance of the fluids of the body. The body has fluids, including the blood, which are just about neutral, either acid or alkali. Certain things tend to make the body acid. Don't worry about me. I'm not disturbed by materialism ever in my life. I'm not disturbed by this. The body tends to be able to maintain a balance between acid and alkali. Things that make the body acid is hard work. Things that tend to make the body alkali is excessive breathing, according to the foods you eat, whether you're eating salads, whether you're eating meats. All these things will tend to make the body more acid, and by that we mean the liquids of the body, including the blood, or acid or more alkali. A kidney has the ability of regulating the electrical nature of the body fluids, and these alone can kill you. A kidney that cannot excrete acid by binding the hydrogen ions which make acids, all acids have got hydrogen ions in them, kidney that cannot bind hydrogen ions to phosphates is a kidney that's letting you down. You become acidic and can't excrete acids, and so on. University 10 years ago, before we consider the digestive system, we should consider the materials which are going to be put into the digestive system. And this leads us to the foods. There are 6 kinds of food, 6 types of food that we all need or all tend to consume. And with my nasty fifth-ray mentality, I like to present things in sequence and order and group them. And so let's talk about the food known as protein. Protein. The essential quality of protein is the nitrogen in it. So immediately you can put the symbol for nitrogen down, and we know that proteins are necessary for a cell to build, to construct its nucleus, the nucleus of the cell, nitrogen, ray 1 if you like. And here we have a most important material, very, very precious indeed, because it is a highly costly material. Protein is the problem of food shortage on a world scale. There's no shortage of food, there's shortage of protein. You should remember that. No shortage of food in the world. The problem is that the food that is available is mainly carbohydrate, and the races that are suffering from malnutrition are suffering from a condition in which there is inadequate protein supply. The essential nature of protein is nitrogen, and built out of the nitrogen is what we call an amino acid. Amino acid. And an amino acid is the building block of protein. The building block of protein. So when we digest proteins, we digest them down to their building blocks, down to their amino acids. Do you understand that? A protein is an agglomeration of hundreds of amino acids built into each other to make a large molecule. And when we digest, we break down with our digestion these various proteins into their components, which are amino acids. The amino acids circulate in the blood, and the liver takes them out and builds them into proteins that we need, like fibrin. Fibrin is a strand of protein which assists in clotting, all right? And it's made up of amino acids in chains. Or keratin. a hard material of the nails is a protein made out of amino acids, or hair, or the nucleus of your cells. Every part of the body, all the cells, the kidney cells, the liver cells, all need protein. And the protein has to be built by you. If you eat roast lamb, you don't smell of a sheep. You take the roast lamb and you convert it to amino acids and then rebuild the amino acids into your own flesh. You don't just incorporate some of the animal's protein into our protein, not at all. It has to be broken down to building blocks. Now that's very important thing to understand in nutrition. Amino acids are part of protein, and there are many, many hundreds of amino acids. But there are certain amino acids which the body has got to have, and they are called essential amino acids. Essential amino acids. They are not easy to obtain. They are not found in their totality in all foods. I think the number, I don't know their number today, but I should guess it's in the neighborhood of about 14 or 15 essential amino acids which are all different. The body has got to have all of those amino acids in the same place at the same time. Otherwise it cannot construct what it wants to do, what it wants to build, the proteins the body wants to build. And only certain foods have got all the amino acids that are essential to the body. And therefore we call these proteins whole proteins. These proteins are such things as egg yolk, and fish, and meat. And occasionally some say avocado, pear. I don't know. I'm not up in my nutrition at the moment. But I do know my basic facts. And so there are certain body foods, proteins, which are whole, and these you have to have at least 18% of your food must be good, wholesome protein. Now this may vary, the figures may vary slightly. I'm just giving you basic propositions. And so we see that although we can do without carbohydrate, although we can do without fat, we cannot do without protein. The moment that you are low in protein, you suffer from malnutrition. And malnutrition can even be hereditary. Typical examples of malnutrition are the Hindu children are born and grow up with long, thin calves to their legs. We used to say in our early days, laugh at the Hindu children and say it's time they sent their calves out to graze. It was a facetious remark, but it's something I've never forgotten. That is the long, thin calves of malnutrition children. You've got to have these proteins, and there's no way out of it. And so, in digestion, this is taken into consideration. You can do without all the other foods like carbohydrate and so on, but not protein. 2, fats, fatty material that we eat. Not essential at all. It is material that is high in energy, but the energy comes slowly to the body. The amount of energy is high, but it is released very slowly in the body. It has to be digested and broken down and reassembled into sugar and burnt and so on. The building blocks of fats are called fatty acids and glycerol. And all fats are built out of this. In other words, you do not deposit sheep fat in your storage organs. If I eat some mutton or sheep, I don't deposit the animal's fat in my fat. It's got to be broken down to glycerol and fatty acids. And then the body will assemble its fats. Do you understand that? Human fats. So there again, the building blocks are important to understand. Thirdly, there is carbohydrate. With this, we have a variety of sugars, and the carbohydrates are basically built out of monosaccharides. And a monosaccharide example is glucose. and another one is fructose. Is that right? Glucose, fructose. Anybody else? There's another one I'm trying to get at. Sucrose is a disaccharide. Lactose, yes. Glucose, fructose, lactose. Now these are mono, meaning they are single molecules, monosaccharides, and they have 6 carbon atoms, 12 hydrogen atoms, and 6 oxygen atoms, and that's a monosaccharide. 2 glucose molecules makes a fructose molecules, and that's called a disaccharide. You don't have to remember these. But again, carbohydrates are reduced to their building blocks, mainly glucose. When you eat bread, the body will break up the bread into glucose molecules, or monosaccharides. When you eat potatoes, when you eat sugar, when you eat rice, when you eat any carbohydrate, the digestion will break the materials down to monosaccharides. Then the body will reassemble these into the structures that it needs. So here are the 3 main foods, and after that it's quite easy to say what the others are. Water is a food. Water is a food. It is used in the body. It is used in various ways in the body, but its materials are incorporated into the body structures, and it's very necessary. 5, we can put down here, mineral salts. Mineral salts. Mineral salts are also important. Potassium is needed for the conduction of nerves, the construction of cells. Calcium is needed for the bones, so is phosphorus. Sodium is needed for nerve conduction. What else? Chlorine, and many other minerals. Magnesium is very important for heart muscle, and so on. All the trace elements are important. And we say in the esoteric that the foods that we eat normally provide these naturally, but we say in the esoteric that we need also to take the 12 tissue salts. The 12 tissue salts. These were the tissue salts of Shusla, the Shusla salts. And they are salts which are in a very trace state. And Shusla discovered that apart from the normal materials of mineral salts, the body requires certain other salts. And he gave them in a list of 12. They include things like potassium phosphate, sodium sulfate, don't worry about them, calcium fluoride, silica, the 12 tissue salts of Shusla. A whole esoteric medicine for you to investigate when you have the time and the inclination. Please. That would be very nice. That's right. So, on the subject of nutrition, think about reading up, looking up the 12 tissue salts. And if you're interested, later I can tell you how you can get these salts and the books for them and so on. It is said by Shusla and other teachers that the first sign of a disorder developing will manifest in the physical body in lack of these salts, these tissue salts in various combinations. Sixthly, vitamins. And those are the 6 foods which man must have. He must have those in order to construct his physical body adequately. And so our digestion now and the organs that I'm going to describe are concerned with these materials, concerned with the breaking down of large molecules of protein into small molecules, amino acids, large molecules of fat, globules of fat, into fatty acids and glycerol, carbohydrates from di and polysaccharides. Cellulose is a polysaccharide. Many thousands of building blocks involved in it. Sucrose is a disaccharide, and so on. Starch is a polysaccharide. And so we come to consider digestion in terms of breaking these materials down. What is the digestive mechanism? The digestive mechanism is a tube. It's a tube 23 feet long. which runs through man. In fact, as I always say, if you want to construct the man, there he is, there's his head, there's his body, there's his arms, there's his legs. That is the physiological unit of a man. He's really just a walking tube from the point of view of physiology. He's a walking tube, and he walks around looking for food to put into the tube. And everything that he does is calculated to keep this tube constantly presented with food. Whether the food that you put into the tube is in the body or not is a matter of conjecture. For me, food inside the tube is not inside the body. Food inside the tube is inside the tube. And it is then for the body to decide which of the material it will absorb. And when we tread the path, we know that we ourselves, in great measure, decide what is absorbed into us. Our state of mind will decide what atoms and molecules are absorbed. This is one of the bases for saying grace at table. The idea being to raise the vibrations of those partaking of the food, so that when they put food into their tube, according to their vibration, they will absorb materials of a similar vibratory nature. Never eat when you are angry or fearsome or horror-struck. Only eat when you are calm and poised. So these things are important to remember, the basic principles. So the next stage now is to consider something of the anatomy of this long tube. Sometimes the tube will be made fat, wide, in order to hold food and stop it going too fast. Sometimes the tube will be segmented so as to grind and pound the material going through it. At the beginning of the tube we have hard grinding materials called teeth, which will break the food down into smaller particles as it goes down further and further along the tube. Then we have glands on the tube, which will secrete materials which will assist in digestion. Sometimes the materials are acid, other times they're alkaline. Sometimes they are made up of enzymes. Sometimes they're made up of materials which will alter the state of the food. Then there is a process in which all the materials which have been broken down from great big particles, chunks if you like, or boluses as we call them, into the finely diffused molecules or building blocks that I was talking about. And only when the food is in building blocks, tiny little molecules called amino acids from the proteins, glycerol and fatty acids from the fats, and monosaccharides from the carbohydrates, only when it's like that can the body then absorb it. So there is a phase in this tube in which all these little molecules are absorbed. What is left behind has to be eliminated. And then the body starts to make instructions in this tube which will allow the process of elimination to occur. Precious substances will be removed from the waste, like water and mineral salts. Eventually, the hardened material, which has no use to the body, will be evacuated. So that's the next thing that we have to understand about the digestive system, that it is a tube which is thrown into all sorts of states and conditions in order to make easy the reduction of large molecules into tiny molecules which can be absorbed into the blood, because it's the blood that's going to take the molecules and circulate them around the body. And therefore the blood must have lots of molecules of glucose so that the cells can take the glucose out of the blood as it passes and burn the glucose and oxygen and do work. The work of reconstructing themselves and the work of running the body. This is the purpose of digestion. We have to remember, however, that digestion involves metabolism, and I'll tell you what metabolism is in a moment, and it is only part of the energy obtained in the body. There is an etheric body, and the etheric body absorbs its energy. It absorbs its energy in the form of prana, prana from vitality globules. So when we talk about the physical body, we're talking about the gross, gas, liquid, and solid tissues, which need food to sustain them, And we're talking about the etheric part of the physical body, which needs prana to sustain it. And the physical body, gross physical body, cannot exist without the etheric. Therefore, prana is part and parcel of the whole affair. The higher you go up in consciousness, the more prana is required and less food is required. If a person is mentally active, he may not need so much food. He may need more protein than carbohydrate. If he is more physically active, he will need quick sources of energy, carbohydrate, sugars, for quick sources of energy. He's going to go on a long hunt for many weeks on end, like an Eskimo. He may call on stored energy as fat. So men differ in occupations, the foods that are useful to them. A man who is highly mental is a man who's going to need lots of mental prana and less food. A man who is emotional is going to need lots of astral prana to keep the emotional body integrated. So we come then to consider this long tract in terms of its specific parts. And now I'm going to just do some free drawings to help you along in understanding this. I'm going to draw the mouth parts, and as I go along I'll describe them to you as best I can. There's the upper lip, there are the incisor teeth, there's the roof of the mouth, hard palate, soft palate, ending in the little tongue or uvula at the back of the throat. Then above that we have, of course, the nasal passage here, and behind that we have a pharynx, F-A-R-Y-N-X, and this is called the oropharynx because it's behind the mouth. That would be called the nasopharynx because it's behind the nose, a very important structure, but not concerned with digestion. Then we have the lower teeth, we have the lower lip and jaw, we have the tongue, and then the tongue enters at the root, enters into making up the buccal meaning jaw, buccopharynx, and this whole thing is called the pharynx. The pharynx, or the tube that runs down in the throat region. Then we are entering now important regions. I'm sure you all understand that part of the anatomy. There's some teeth there, and we'll put some teeth in there. That's quite easy. The moment we enter the buccopharynx, we find an opening which is the windpipe. The windpipe. And the windpipe has got rings of cartilage on it, like a goose's windpipe, which prevents the pipe collapsing and always allows air to go through it, and these rings of gristle or cartilage keep it open, and it goes down into the chest and divides into the lungs. There's one lung and there's the other. We're not interested in that system here. We continue down here. Incidentally, it's got a tiny little flap on it called the epiglottis, and when we swallow, the epiglottis shuts this windpipe off and stops us swallowing food. Then we have a long tube, muscular tube, about 12 inches long, which is called the esophagus, and it's got muscle on it, which is not under control of the will. You swallow a hot potato, you can't bring the hot potato up again. It's got to go all the way down, and you feel it as it goes down. And you've got to damn well sit there until it does go down. There's nothing you can do about it. It's in the esophagus. Now, the esophagus goes through the thoracic cage. The thoracic cage is the cage made up of ribs for breathing. It goes all the way down through there, and it enters into the abdomen. It has to pass through a layer of muscle that is so important esoterically, known as the diaphragm. The diaphragm. It passes through the diaphragm, and then this tube, and that's after all we're talking about, is this tube going through the body. It's 23 feet long, and the moment that it penetrates the diaphragm, it emerges into a sacculation called the stomach. There's the stomach lying just there. Now, there's nothing hard difficult about that piece of anatomy, is there? Not when I present it to you. It's very, very straightforward. And we can then add some bits and pieces to it which are less obvious. Up here, just there, in front of the tragus of the ear, that little piece of cartilaginous gristle material that guards the external auditory meatus, or lugol, as the Cockney would say, just in front of it there is the parotid gland, I'll put it in here. Let's give it, well, what's wrong with that for a color? The parotid gland lies just under the skin. It's a gland which, when infected, gives us mumps, a nasty complaint, a very, very painful complaint, in which the jawbone can squeeze this gland between itself and the upper jaw in agonizing pain. A serious condition in adults, especially men, because the parotid tissue is very similar to the tissue of the testes, and the mumps virus can infect the testicles and cause very, very painful swelling and infertility. So in men it is no joke at all. In children it's laughed off and they hardly notice it. The parotid gland secretes the saliva, the liquid aspect of the saliva, a very serous, watery fluid. And this watery fluid passes along the parotid duct, which runs inside the cheek and opens up just above the second premolar tooth. Don't stick your dirty fingers in your mouth tonight, but sometimes when you're in the bathroom, you can, with a clean finger, feel the opening of this parotid duct just above the second tooth that's got a double edge to it, double cusp to it. And just above there, the parotid gland opens, or the duct opens, and it pours liquid saliva, serous saliva, into the mouth, which is so important for the digestion. This saliva contains not only liquid for making the food moist so that it'll slip down the throat, but it contains also an enzyme, a chemical, which begins the breakdown of carbohydrate food, begins the breakdown of starch materials into monosaccharides or glucose. That's the parotid gland. We have underneath the tongue submaxillary and submandibular glands, which also secrete saliva, the saliva being a little thicker than the material coming from the parotid gland. So here we have the first elements of the organs of digestion. The lips are highly sensitized. They have got a great nerve supply, very, very powerful, not powerful, but yes, a strong nerve supply. And the lips assess the nature of the food that's going to come into the mouth. If the food is hard, it's a piece of apple or something like that, it will be passed immediately by means of the tongue to the back of the mouth, where heavy teeth will crush it. If it is something that has to be bitten through, a fairly soft piece of material, the tongue will pass this material to the front, where scissor-like teeth will chop it up. And when they're chopped up, the pieces go to the back and are ground down. What I'm saying here is that we have a set of 32 teeth in the upper jaw and the lower jaw, which are shaped in different fashions in order to deal with the different kinds of food. There are the front teeth, which have got sharp single edges, knife-like, scissor-like structures that can cut. There are the back teeth, which are heavy with many cusps on, which can crush and grind food, and so on. All this is elementary. I'm sure you understand it. What happens now is that food passed into the mouth is churned about, broken up by the teeth and the tongue and the cheeks working in coordination together, and a bolus is formed. A bolus is formed, which is the food material shaped into a pellet shape. A pellet-shaped bolus, B-O-L-U-S, and it is slimy, and in deglutition, or swallowing, the bolus passes down the pharynx into the esophagus, and what word do they use for the esophagus? Gullet, I think. The gullet or esophagus, and it passes down, and contraction, muscular contraction under the control of the sympathetic nervous system, not the controllable nervous system, the uncontrollable one, the subconscious one, passes the bolus down into the stomach where further digestion takes place. A dilatation of the long tube that passes from mouth to anus, all 23 feet of it, through the body. The stomach is a dilatation of the tube which comes just after the esophagus. The esophagus is a long muscular tube that must pass through the thoracic cage without impeding the contents of the thoracic cage. The thoracic cage contains the vital organs of the lungs and heart. The thoracic cage, as we shall see later on, is something that has to expand and contract because the lungs increase their size tremendously, and so does the heart. And therefore the tube that passes down through the thoracic cage is one which is not under control of the mind. Once you put food into it, the sympathetic nervous system will hurry it down immediately into the dilated portion of the tube known as the stomach. Any pause halfway down here would crowd the heart and lungs and produce conditions of stress and congestion. And so we're now in the region of the stomach. The walls of the stomach are thrown into 3 layers of muscle. 3 layers of muscle in the walls of the stomach. One layer is longitudinal, wrapping the stomach around longitudinally. Another layer is horizontal layer of muscles, and still a 3rd layer of muscle runs obliquely, surrounding the stomach in quite a strong network of muscles. The effect of the muscles is to contract the stomach into every shape conceivable. Generally, we talk about the stomach as being J-shaped. If you are an ectomorph and you have a Ray 1 physical body, that will be the shape of your stomach. If you are an endomorph and have a very great interest in food, that would tend to be the shape of your stomach. And so we get all shapes and sizes. Add to this the fact that these circular muscles and other kinds of muscles throw the stomach into further shapes. The whole process of contraction of the stomach muscles is to mix the food in here, churn it, and to saturate it with the gastric juices. The word for stomach is gastric juices. So we have really a man-made churn, a human churn. To prevent the food from sliding immediately down a whole 22-foot length of pipe, of tubing, of the alimentary canal, there is a purse string sort of muscle holding the opening to the stomach tight. And this is known as a sphincter, and it's called the pyloric sphincter. The pyloric sphincter, innervated by the sympathetic nervous system, and it is relaxed by the parasympathetic nervous system. The parasympathetic nervous system, usually related to the vagus nerve, causes relaxation of that part of this ring of muscle. We must remember that the layers of muscle are innervated by sympathetic nerves, which tend to cause the muscle to constrict and contract, and it is also innervated by the vagus nerve. The vagus nerve passes 2 large branches down the throat, through the diaphragm, there's the diaphragm, and the vagus nerve innervates the wall of the stomach. The vagus nerve tends, apart from its muscular action, the vagus nerve tends to increase secretion of acid in the stomach, secretion of acid in the stomach. And when ulceration of the stomach occurs, we'll talk about that in a moment, producing gastric ulcers, then vagotomy is often performed. Vagotomy meaning that the vagus nerves are cut, supply the stomach wall with innervation. The vagus nerves are cut. The question is often asked, should you undertake vagotomy, have your vagus nerves cut if you have a gastric ulcer? My answer to that is I wouldn't, but then I don't have gastric ulcers. And the alternative is dietary action. The alternative to that is operation, where the gastric ulcer is removed. It's not a very pleasant alternative, and I would say that one should, if possible, use nutritional methods, use any method which would increase the blood supply to the stomach area, and definitely this is something where esoteric healing should be applied, where the subject has first of all had medical advice, and you will always come across sooner or later people with gastric ulcers. So now we've talked about the mechanical action of the stomach. Mechanical action of the stomach. The stomach's vagus nerve is related to psychic faculty. By psychic, I don't mean our psychic. I mean the psyche, thinking. The sight of food causes the mouth to water and the stomach to secrete its gastric juices. So there is, as it were, a psychic phase of digestion, and it's quite an important one. The preparation of the intestinal canal for eating is part and parcel of nature's way. Sight of the smooth food, the aroma of the cooking bacon or whatever it is, conjures up, as it were, a flow of stimuli which causes gastric juices to be secreted in the stomach, so on. Now, let us look at the wall of the stomach, the wall of the stomach. It is thrown into folds. It is thrown into folds, but the wall, when you look at it with very like a piece of tripe. Does anybody know what tripe looks like? Well, tripe has got sort of raised edges to it, something like that. And inside these discrete areas, there are tiny little holes and raised areas, and that is the general appearance of the surface of the stomach. In fact, what we find in the surface of the stomach is that there are pits in the wall, holes which are the opening to sunken wells or pits that descend into the stomach wall like that. And the walls of the pits, this is the inside of the stomach, the lumen of the stomach, yeah? The walls of the stomach have cells which secrete a variety of materials into the pits, which we call gastric juices. Now, the incidence of these tubular structures in the wall varies. We tend to have acid secretion in the curvature of the stomach, and at the top part of the stomach, which we call the fundus of the stomach, we tend to find, in fact, mucus secreting cells which secrete a whitish, sticky material from the lining of the stomach in the fundus area. There's also a little sphincter muscle here known as the cardiac sphincter, and this will tend to hold the food in conjunction with a pyloric sphincter. So the openings to the stomach are contracted during digestion, and the stomach contracts and moves and alters its shape continuously, turning the food up inside. According to the type of food you have eaten, the stomach tends to remain closed for a different length of time. Food that keeps the stomach closed longest for is in fact fatty material. By a mechanism that I'm not going to describe now, the stomach opening, that is the opening of the pyloric sphincter here, is decided at the time, the type of food that we have eaten. When the food is truly mixed, and after a period of time, the pyloric sphincter opens and the material in here is squirted through the pylorus into the duodenum. There's the duodenum. Said to be 11 fingers this way, 5, 10, 11 fingers. Curve in the alimentary canal immediately after the stomach. Now, the gastric juice, we've seen that there is mucus, and the mucus has a function in the gastric, in the stomach, and the function is to help mix the food, to make it slimy, if you wish, so that it can move about, and also its function is said to be to line the wall of the stomach, so that the acids being secreted from the stomach gastric pits will not digest the stomach wall. These acids are extremely powerful. They have a pH of 1, and if they were placed, I should say when gastric juice is placed in a container and meat is put in it, the meat is very, very quickly eroded and digested. Acid that digests the meat, it's a material known as pepsin, and the pepsin cannot work. It is an enzyme. Pepsin cannot digest the meat unless it has got acid present. So a person with achlorhydria, person without hydrochloric acid in his stomach, is a person who's going to suffer from various stomach gastric conditions. Another material, so we've got mucus is secreted from the cardiac region, acid and pepsin are secreted from the gastric pits, and another material that is important is vitamin, it is the intrinsic factor. The intrinsic factor that I have mentioned already. The intrinsic factor is a material that allows, later on, when the food leaves the stomach, allows the very important vitamin B12 to be absorbed. Vitamin B12 is found in many foods, green vegetables, leafy plants like lettuces and things, and it is a very important vitamin in the body. It can only be absorbed later on through the walls of the intestine when we've eaten it if there is present secreted material from the wall of the stomach called the intrinsic factor. If you haven't got a satisfactory stomach surface or lining, and you don't secrete the intrinsic factor, or you're lacking in acid production, you won't absorb vitamin B12, your red cells won't mature properly in the bone marrow, and you suffer from pernicious anemia. Pernicious anemia. In the old days, of course, people had to eat an enormous amount of liver and materials like that to make up for this deficiency. Today, we have materials that can be eaten that overcome the problem of pernicious anemia. So now we're trying to get through this layer, this layer of the wall of the stomach, and we see that it has got the surface of the stomach, and this is called the mucosa, the surface of the stomach, a mucosa. You see the pits going down into the mucosa. We know that there are layers of muscle, 3 of them, and we can put in blood vessels, which pass into the stomach and supply blood vessels to the mucosa, like that. And that's just about all we have to know about the muscularis mucosa of the stomach wall. Now, the problem that usually arises here, I'm going to point out some problems that you're likely to come across. The first one is a hiatus hernia. A hiatus hernia. A hiatus hernia occurs at the opening in the diaphragm. Remember that the diaphragm is a piece of muscle that separates the thoracic cage, the chest, from the abdomen, and that's the diaphragm. There's a muscle that takes place in breathing. Deal with that tomorrow night when we talk about respiration. Now, in people who have got a weak opening to the diaphragm, by that I mean that the wall of the diaphragm is weak, and the stomach can well up and bulge. The stomach can bulge through the diaphragm into the chest. Frequently occurs in fat women where there is increasing pressure on the abdomen, where they may be using corsets, and they have certain symptoms of the condition. When they bend down or stoop, or when they have overeaten, they get burning pains here in the chest, just below or near the so-called heart region. And this is usually as a result of this bulging. Sometimes they feel like bringing up material, and this is because the contents of the stomach, the acid, other materials, has come up into the esophagus through the weakness of the diaphragm. So that is a hiatus hernia. And like to operate, they usually try and advise these people to reduce weight, and they need, in esoteric healing, they need strengthening of the diaphragm.